our job is to educate our patients, because the more they know, the more they're going to feel empowered to make those changes in improving their health. If they're eating too many pro-inflammatory foods, what occurs? They increase their adipose tissue and they become overweight or obese. This is another important factor in neuropathy, because excess body weight or obesity is a triggering factor in their pain. But let's start with a short quiz before we dive into the discussion here. So the question is, which one is not correct about adipose or fat tissue in overweight or obese people? A, creates pro-inflammatory cytokines, which increases inflammation. B, it secretes the hormone leptin, which regulates body weight. Or C, it secretes growth hormone, which induces tissue growth. And again, the key word here is which one of these is not correct about adipose and fat tissue. We'll give you a couple of moments here and you can put your answers in the chat. All right, great. Well, if you answered C, that is the correct answer. It is C, adipose tissue does not secrete growth hormone. And we'll kind of dive into what adipose tissue can do in terms of what it secretes and how it is correlated and can trigger neuropathy pain in your patients. So what happens with adipose tissue is that when there's an increase in adipose tissue, this can actually increase the immune activation of inflammatory cytokines. And aside from the metabolic neuropathy that can occur with increased adipose tissue, this is further associated with chronic inflammation, and this is a direct link to hyperalgesia. And this is when your patients are more sensitive to pain than normal. And with that, that can worsen not only their existing neuropathy, but other sources of chronic pain as well. And here we can see that adipose tissue is now recognized as as it secretes a variety of adipokines and cytokines, both anti-inflammatory and pro-inflammatory cytokines. Like Dr. Cohen and I, we have the pro-inflammatory red shirt and the anti-inflammatory blue shirt here. So this happens with the adipose tissues as well. But here is the kicker. This is what the research is showing. When your body starts to hold on and increase its adipose tissue, we can see on this image here that it actually will start to go into the pro-inflammatory cytokines, and it starts to increase inflammation. And some of those cytokines include the TNF-alpha, the IL-1, the IL-6, interferon neuron gamma. What the good news here is, when you are educating your patients that when they have an increase in these adipose tissues from their pro-inflammatory diets, we can start to give them protocols to decrease that adipose tissue. And what happens when you start to decrease that adipose tissue? Well, what the adipose tissue will start to do is it starts to excrete more of the energy metabolism and immunity, such as the leptin and some of the anti-inflammatory cytokines to decrease inflammation, such as the IL-10. So it's extremely important to understand that maintaining a healthy weight, choosing those anti-inflammatory foods, and providing your patients with an anti-inflammatory food list or a guideline, or having them work with a functional nutrition coach will be very beneficial for that. And then having them stay physically active. These are all important aspects of the lifestyle and of the lifestyle approaches that we often incorporate for our treatments with our patients. And this is important in reducing chronic inflammation. And this can help with the chronic pain, including nerve pain associated with neuropathy.
Last time that I checked, how many supplements are there for neuropathy? Just on Amazon, there's like dozens of different types and probably hundreds on like just everywhere around us.
Mhm.
Most of them are just selling them like the idea of like a quick fix. And I've had patients even on Social Security, older patients on a limited budget that, and you might have seen it too, those patients that come in and they're on a limited budget, but they come in when they spend like $200 or $300 every month on like different a bag of supplements, right?
Right.
And you ask them like, why are you taking this? I'll never forget those patients. They bring their bag of supplements, and I'm like, I'm pulling supplements. I'm like, what are you taking this for? And it says, well, I read that this is good for my neuropathy. I read that this is good for my diabetes. I read this is good for weight loss. I read that this is good for whatever it is. And in most cases, it's just a very low quality product. Or I've seen products that have like alpha-lipoic acid, and it says like research-based ingredients, right? Like these flashy headlines, and there's like 80 milligrams of alpha-lipoic acid, right? So it's
Right.
like, I mean, come on. I mean, that's not really gonna do much, right? So it's important for us as healthcare practitioners, and that's just my own. I know that my own philosophy and also yours, is that we should be we should continuously develop our skills. We should continuously be able to offer better and better guidance to our patients, because if we won't do it, who will, right? When we talk about supplements, there's a lot of nutritional lifestyle strategies, herbal strategies, which are a little bit more advanced in the program. You go into herb pharmacology and how to use herbs instead of using drugs. But for now, I want to talk about one of them, right? One of those compounds, and that's alpha-lipoic acid. Now, alpha-lipoic acid is an antioxidant. It's a organosulfur compound that occurs naturally. You can find it in nutritional yeast, spinach, broccoli, potatoes, meat organs like liver or kidney. And the alpha-lipoic acid was reported in several studies to lead to a significant improvement in neuropathy symptoms. There's one particular clinical study, it was a systemic review study that reported that alpha-lipoic acid was found to lead to reduction in total symptom score and improvement in measurable nerve conduction. So there is some indication that it's not only helpful for reducing the pain, but it's also supporting the healthier function of the nerves. Now, what are the dosage consideration? So the study reported between 600 to 800 milligrams per day. It's important to know that most studies have used 600 milligrams per day, and some studies have used a simple oral supplementation while others used intravenous. So intravenous will typically be 600 milligrams. If you're doing a simple oral supplementation, one capsule is 600 milligrams. You can do that once or twice a day. And we have seen really good results with supplementation that involve alpha-lipoic acid. If we do a combined approach where we do a functional medicine evaluation session, help them to figure out what's driving that inflammation, and then over the course of the next 3 months, they take alpha-lipoic acid at 600 milligrams once a day for a minimum of 3 months, right? While we help them to start reducing some of the inflammatory foods that they're eating, we have seen reduction of pain between 50 to 100%, right? And I'm talking about some of them are really tough cases. They're maxed up on gabapentin. They try different things. They're taking NSAIDs. They're trying everything they can. And we've sometimes see 50, 60, 70, 80% reduction in pain, right? So it's like, it depends on how much the patient is compliant. It depends on your clinical skills and your communication skills. But, one step at a time. Like when you see the patient, you might recommend like one simple supplement, right? Like alpha-lipoic acid, maybe 600 milligrams or once a day or twice a day, right? And then over time, ideally, we would really want to sit with the patient and understand what's causing that damage, what's causing that inflammation, right? If it's caused by diabetes, then learn about what triggers diabetes, right? We teach that in the programs. So, and then help them with some dietary changes. Remember, even simple strategies: add alpha-lipoic acid, add, that's like one capsule a day. It's not even expensive. It's like you can find it's like $20 to $30. It's not very expensive, right? You can add a good supplement of omega-3s to help to mitigate some of that inflammation, right? We talked about 2 to 3 grams per day. So what we're looking for is simple strategies to help our patients during the first 3 to 6 months towards recovery, towards feeling better, while we help them to find the root causes of their disease or condition or symptom. That's why they're going to come to see you instead of keep on jumping from one doctor to another nurse practitioner to another specialist to another, and they still struggle, right? That's, by the way, why many of our community members are getting paid between $200 to $800 per one session, out of pocket cash, right? And so we want to offer a unique service to our patients that help them to restore their health, right? And as always, our goal is really not to get our patients to be dependent on any type of supplement or any type of drug. We always used to tell our patients in our practice that if we do a good job together, us and them, we do a good job, then we expect to see a significant improvement and reduction in their pain within the first 3 to 6 months. And we want to get them to the point where they understand what's causing their sickness. They know how to take care of themselves, right? Do self-care and carry on the improvements, right? Without needing us, without needing more drugs, without being dependent on us or anybody else, right? Because our number one goal is always to help our community. I hope everybody will have a wonderful evening. Take care of yourself, and we will see you in the next class.